We're going now from Africa to Asia, and our next speaker is Dr. Wannapa Suwonkerd, who is from the Division of Vector-Borne Disease Control of the Ministry of Health in Thailand. Her presentation will be how interactions with communities influence vector control research directions and governance policies in Thailand. Thank you.
Thank you. Good afternoon, everybody. Yes. First of all, I would like to thank the committee that invites me here. So I would like to talk through these contents. Unfortunately, I have 40 slides, so for the first 20 slides, I will go very fast. The most important vector-borne disease in Thailand are malaria and dengue fever. And we have the first outbreak of dengue fever in 1958. At that time, the case fatality rate was very high, more than 10. And nowadays, the case fatality rate reduced until less than 0.2, but the case rate never reduced. And this is a true Aedes mosquito that transmitted dengue in Thailand. And nothing has changed over the 50-year experience. The breeding size same, and the behavior of the people still never changed. So came to malaria. We have a 60-year malaria control history, and now we are proposed for malaria elimination by 2024. The problem is still the same at the border of in the international border, especially the Myanmar border. And the epidemic month of the malaria also being the same for many decades in rainy season and also in the second peak in the cool dry season. And the problem is still in the, as mentioned, the hardcore is close to international border. And this is the three main malaria vector in Thailand. And for the vector control of the vector-borne disease in Thailand, we have environmental management. And this is mainly for dengue fever. We try to reduce the breeding site or the habitat or water storage container. And as well, we try to convince the biological control using the larvivorous fish. This is seemed to be bottom up, and we thought if the people participate, this will be sustainability. But maybe this one needs special process to convince the community to participate. And the next one will be the try to reduce man-vector contact using the insecticide-treated bed net or insecticide-treated material, long-lasting or just ordinary impregnated bed net. And as well, we use the insecticides to control the mosquito, especially the malaria vector, by purpose to reduce the longevity or vectorial capacity of the mosquito vector. And we use mainly IRS or indoor residual spraying, but this will be effective only a few months or maximum 6 months, depending on the insecticides. This will be top-down, and we need a lot of budget for this activity. The last one, we use integrated vector management. That this one needs all stakeholders to involve. And this the current insecticide used for vector control right now. Mainly we use the pyrethroid. For biological control, one question is how frequent is we have to reintroduce the fish in the community. So this is maybe not effective enough, but we just use as additional. And as we know, when we use the insecticide for a long time, of course, the mosquito in Thailand already, Aedes aegypti, as well Aedes albopictus and Anopheles, some species already develop resistance to many kinds of insecticides. And a number of interventions to control and prevent vector-borne disease exist, but some will be more appropriate than others depending on many factors. So this, I would like to say about the potential benefit of the gene dive. Of course, we would like to reduce the insecticide use, because if we can reduce insecticide use, it means the insecticide resistance will be also reduced. And as we know that the vaccines development already many decades, but it's not totally achieved. So if we have something else that maybe not just gene dive, but some other methodology to control the vector, that will be appreciated. And for the gene dive, I'm not sure, but when we would like to control some vector, we may think about their behavior like biting time. And for Aedes mosquito, it's the daytime biting. So when we would like to do the space spray to control Aedes, we have to go to the community or to the village during daytime. That sometimes is not appropriate because the house villager and many people, they leave the house for work. So we could not even spray either inside or outside the house. So if we have something that it could be effective during every time, not just daytime, it must be good. And of course, it will be reduce burden of disease. And if we can reduce the use of insecticides, yes, it will be reduce harm that's caused by chemical control measure. For example, effect on the non-target species like birds, human, or beneficial insects. And also reduce the environmental contamination to the water or soil. And also some chemical have some allergy impact on children and elderly people. I like to say in Thailand the gate is still open because among the 15 key performance indicator of our prospect, we is one of the research that we are still welcome multi-sectoral inter and international cooperation for the research. And when we would like to do something in the community, we have to think about these two big ministries. It means Ministry of Public Health and Ministry of Interior. So the Ministry of Interior is a province governor and also the provincial administration office and district governor and municipalities. Under the district, we have sub-district, so-called tambon or sub-district administration office. That one also key. For the public health side or the leg of public health, there are two main importance. Mean permanent secretary, this one, and this is a Department of Disease Control is my department. And under the permanent secretary, there are 76 provincial health office, and also under the provincial we have district health office. And under this provincial and district health office, we have the Tambon Health Promoting Hospital. This is a former, in the previous time we call health center. And the Tambon is mean sub-district. And this is the district general hospital. There are 13 of the Office of Disease Prevention and Control all over Thailand. So the Thailand public health policy to work with the community, we need the ethical clearance. Any protocol that will work with us needs ethical clearance, and the ethical clearance from elsewhere cannot be used. The research team must submit to the Department of Disease Control, Ministry of Public Health, both Thai and English version. This step takes at least few months to approve. And as well, we have to inform the provincial level, like I mentioned before, provincial health office or Office of Disease Prevention and Control, and district level, including the interior size, municipality, local office, and also sub-district level, also called Tambon, Promoting Hospital, and local administration office, as well the canton head. And if we're working in the village, of course, we have to inform to the village level. That means head villager and village committee, as well village health volunteer. The village health volunteer is working under the Ministry of Public Health, and also the school and the temple in that area. So how to approach to working with the community? First, we shall understand that earn while living is the first thing people think of each day. What to eat, how, where to get money, food to feed themselves, their family and kids. Health is second or third or last thing for them to think about, unless or until they have a health problem. So I would like to show 2 examples of the lesson learned in community-based disease control. First is participatory action research on dengue prevention and control. This is all we call PAR. And the second is behavioral response of mosquito to insecticides. We use a mark release technique method. This one is collaborate with the USUT and Kasetsat University in Bangkok. So I would like to mention about the PAR first. So in the first phase, we spent 3 years in the community. For the first year, it's very important because we need the community to trust what we are doing. And we don't want to guide anything for them. We like them to identify problems by themselves and planning by themselves what to be done to solve the community problems. And this is take many months that before they trust us that we will go and work together with them. And the second year, the planning into practice, learning, obstacle, and progress. And last year, we do the monitoring evaluation. And then the second 2 years, we have nothing to implement. We just let it like routinely. And this year, we did the effectiveness evaluation by CAP survey and also lesson learned, visualizing, focus group discussion, data situation analysis of the this dengue. And this one I talk about dengue. And to see the sustainability in the village. That after we have the PAR for first 3 years and how it lasts in the community. And we found that we got some model of dengue fever prevention that is composed of 3 dimensions of local administration office, or I would like to call LAO, and second one is communities, third one is public health sector. So in the community is very most important. We would like them to be strong or self-reliant. Support this one, we construct 36 community researchers that live in that community. And we would like to have more, twice of 36 become 72 community researchers. So I call budding to be have same people that can think about the problems of the community and plan by themselves. And for the LAO and public health sector have to working together, collaborative and reflection. And as well, like the public health sector, we do have all data. We know where the disease occur, where the outbreak occur. But for the LAO, they know nothing about the disease situation, but they have a lot of resources. They have budget, they have the human being to do the vector control. So this 2 government officers have to work together and then link to the community. And we got the sustainable of the dengue fever prevention model in this study. This is just an example of our activities. And the second one is behavioral response of mosquito that we use the mark release recapture. We mark the mosquito with the fluorescent dye and then we use the experimental hatch and release and recapture. And community was very interested in this study. They asked several questions: where the released mosquito came from, where mosquito body was less color, any danger to the environment, how long they will survive, will our mosquito be recaptured, what about the recaptured released mosquito, will mosquito transmit the disease, many questions. And the public has a right to know what we are attempting to do in their communities. And I found that the lesson learned in community-based disease control, first step, the preparation of community is the most important thing to do prior to the experiment. We need the community to trust us. Once they trust, they will be protect and receive a response to all questions, to all problems that may arise. But many ways to approach community like IEC, information, education, communication, or PAR, or many things, and also public knowledge. Information of the total process, transparency, we have to explain to the village all the process that we were going to do. And we also have to understanding the history of community, culture, and investigate our participation. For the second, the safety of the people and environment. For my study, we use the local specific strain of mosquito population to do the mark and release. So we have something to explain to the village that we didn't introduce any new thing to your community. And also, if possible, in the modified mosquito, maybe the bacteria or virus is better is from same local for community. And then it's no adverse effect to the nature and on the existing predator that already exist in that environment, like the toxolinchitis or the giant mosquito or the other predator. For the benefit at the individual, I know, I'm not sure somewhere else, but in our country, they do not want money for individual, but incentive to community may be welcome. And in the study, if the study will be done for a long time, the team need to participate in the activity of communities, like understand culture, joining community campaign, temple donation, road construction, house visiting when some people sick. And also when the community will respect and cooperate if you are sitting in their heart. Talk the same language, understand what they are doing, and learn some local language to continue relationship. Transparency is very important. Informed consent form must be done. And after we get some information, finding result, we have to feedback to the community. So I just conclude that over my 30 years experience in the field, a lot of things have been changed, including environment, land use change, climate change, and also human behavior and human interaction to people from outside. And we have to know that now the technology is or become very popular. Everybody have smartphone, they can access TV 24 hours, 7 days, and nobody is a fool. And then avoid a top-down policy, use participatory policy or proven bottom-up policy. School-based or region-based protocol may also be needed, as these institutions are key. And generally, a community has people who are respect and believe. This is one of the channels to approach a community, like a former teacher, monk, or folk doctor, and people with the folk wisdom. This is just a key take-home that policy is, I think, is important within the country and maybe in the neighboring country. If we do something very close, like in Thailand, we have 4 country border, very close area. We do something, release mosquito or something. Maybe we have to. I think we have to think about the neighboring country policy as well. If they know that we release something or we do something. Maybe we don't do it's very close to the border, but if it's not very close, for example, malaria is not a problem. So the risk to the ecology and environment, so this is a safety in short, mid, intermediate, and long term. And the risk assessment, like somebody talked in the morning, and public acceptance and willingness. The thing that might happen during or after experiment or implementation periods. For example, the pet or animal or economic animal die. Sometimes they die from something else, but we thought it's because of our study. As well, the coincidentally people get ill but blame the new study or the change. Potential risks from the pathogen, for example, the opportunistic pathogen or toxin also, we have to think about this. And the last one is a concern related to resistant parasite, for example, the malaria drug resistance. If we do something, this group of parasite might be targeted as well. For the mosquito itself, the mosquito diversity also need to be considered, like behavior, dispersal ability, mating competitiveness, longevity of the male mosquito, and try to use the local population. That therefore no introduction of the new species, no the longevity of release modified male, that's how long it will persist in the nature and will not harm the environment. This is self-limiting. So this just a few slides for the suggestion. Thank you.